Hello, good afternoon, ladies of Delhi, India, and the world. I am Dr. Mrs. Ramesh Serene. I'm a senior consultant in breast surgical oncology at the Indraprastha Apollo Hospital, New Delhi. I am passionate about breast cancer and women in general. I also run an NGO called Forum for Breast Cancer Protection, whose main aim is to spread breast cancer awareness, its early detection and treatment. Today, on the day of International Women's Day, I congratulate every woman in India and the world across. I think whosoever started this started it off in a very good way, because I feel that women should have a special play or a special place in the society. And the reasons are that we do four tasks at the same time. We look after the family, look after our children, look after our in-laws and extended families. We also we take part in equal careers as the men, and then we are responsible for the health of our family, our husband, and ourselves. But sometimes, in the middle of all this big load of work on your shoulders, you forget that your health is very important. So please, on this day and in other days, pause for a second and see that you have time to look after yourself. And in this respect, we can only have a good health. And if you have a good health, you celebrate life, you enjoy life, you enjoy every small things that happen in the family and in your career and in the people around you. If you do not have a good health, I'm afraid even the happiest moment look pretty dull in your life. So please take a stand back and give some time to your health. Now, health in all respects, whether you eat a healthy diet, you exercise, you look after your uh, general health in the way of cleaning and cooking and everything else, you should also do some basic screening examinations that are required at various stages of life. And I'm going to talk to you a little bit about cancer in general, because that's what my forte is. And I must tell you that cancer in India is on the rise. According to WHO, the cancer is going to become the commonest cause of death in India in 2020. If we talk about breast cancer, the incidence 10 years ago was 1 in 28 women who will get breast cancer. And now it's 1 in 22 women who get breast cancer in the metros. And in 2020, the prediction is that we are going to be the same as in the West, which is 1 in 8 women will get breast cancer. And that's a very scary thought. You might ask, why is this cancer in general and breast cancer in women is increasing in incidence? And what can we do to prevent it? The reason why breast cancer is increasing in India is our lifestyle and industrialization. With the industrialization, our lifestyle is changing. We are eating fast food, we are not exercising, we are putting on weight, we are drinking a lot more than what we used to do. And for men, at least in India, smoking more. So with industrialization, there is also atmospheric impurities. the vegetables, what we eat, what we drink, what we breathe, we don't really know what the toxic things are in there. Now, these things are going to stay with us. We are not going to go back to our olden times where we can say that we will not work. We will work, and at the same time, we possibly don't get time to do our exercises. But then one has to think about your health. Again, the problem in India is that two-thirds, almost 60% of our women with breast cancer or with cervical cancer come in stage 3 and 4. Stage 3 means whatever you do, whatever the best treatment you might have, even if you go abroad and take the best treatment from the best center in America or in Europe, your chances of living normally thereafter is less than 20%. Now, if you come in stage 1 or stage 2 of breast or cervical cancer, which are the two commonest cancer in female, your chances of living normally after the treatment is almost 90%. So if somebody can tell you that this is what you should do to detect a cancer, breast or cervical cancer early, because even if you're the one to get it, your chances of becoming normal are 90%, which is as good as 100% to my mind, because the 10% you can take it with your positive attitude. So why won't you do it? Why won't you go in for screening test? And why won't you go to the doctor if you have any symptoms? Now, let me talk about breast cancer first, and then maybe I'll touch upon the cervical cancer. Breast cancer, almost 100,000 women in India get breast cancer every year. And if I tell you almost 60% of them die because of the late diagnosis, that's a very sad story. While in the US and Europe, where awareness has really gone very well, there is almost 15% to 20% who die of this, 80% live normally. So I think it's time that in India, we should do awareness programs like the one you're having now, and where I'm going to tell you what are the screening methods and what are the early detection methods. Why shouldn't we do it? Especially if it doesn't take much of your time from your busy life or from your busy family life. So let me tell you what is a screening method for breast cancer. For breast cancer, the screening means that you get tests done even before you have any symptom or any problem with your breast. Let's say lumps or pains, before you have anything. These are called screening methods. And there are 3 screening methods for breast cancer. The easiest one is a breast self-examination, though as the American Society of Oncology does not recommend it, and that's because their women go for annual mammography at the time they're required to. In India, still the annual mammograms will take a long, long time to come. So the easiest method that we can do is a breast self-examination or BSE. The breast self-examination means you examine your own breasts sitting in the comfort of your own home without going to the doctors, without paying any money, and without spending much time on this busy and crowded roads of Delhi. What is breast self-examination? There is one looking part and there is one feeling part. And I think you can see it in various magazines, how to feel for your breast and how to look for your breast. It will take you no more than 5 minutes. Please do that once a month after the age of 20, especially after you have had your periods, because that's the time your breasts are the softest and there is no nodularity. After the breast self-examination, once a month, if you have any change in the shape or size of your breast, any lumps in the breast or in the underarm, any discharge from your nipple, or any indrawing of your nipple or any tethering or any thickening of the skin or the nipple or areola of your breast, please consult a doctor. Have one opinion at least. I must also tell you, so that you don't get scared and don't get sleepless nights, is that 9 out of 10 times, if you find a lump in the breast, it's not cancerous. So don't worry, just go to the doctor and get the complete investigations or clarify your mind. The next screening method is called clinical breast examination, which should be done by the doctor. It should be done once a year after the age of 30. A doctor hands possibly are more sensitive because this doctor is doing this for a long time than your own fingers. So once a year after the age of 30, you can go for a health examination. You can go for a pap smear, clinical breast examination, your blood pressure and your sugar. Clinical breast examination is done in the same way as the breast self-examination, but the doctor does it. After the age of 40, we do recommend mammography once in 2 years and once a year after the age of 50, but that can be debated, but at least have a baseline mammogram at least at the age of 50 and thereafter. There are some women who are more prone to get breast cancer than others. These high risk women are where there is a family history of breast cancer, where your mothers, your grandmothers, your nannies, or your great grandmothers have had breast cancer. Or if you had breast cancer in one breast, your chances of getting breast cancer in the opposite are much higher. So, and also if you have had no children, or if you haven't breastfed, or if you had children after the age of 30, you are at a higher risk. Research has also shown that if your period starts before the age of 12, or they stop after the age of 54, or if you have taken hormone replacement therapy after menopause, your chances of getting breast cancer are slightly higher. Again, there is a connection between the high risk and weight, obesity, inactivity, and diet. If your diet is not right, if you are obese, and if you are not doing any physical activity, in the chances of getting breast cancer are higher. So these are some of the risk factors, and if you have any one of these risk factors, just consult your doctor or your gynecologist and get appropriate screening tests done accordingly. Now, these are the 3 screening methods. Now, if you have had these screening methods or you haven't had time to go for them, then the early signs of breast cancer, as I said earlier, are a painless lump in the breast. 80% of the time, breast cancer presents with a painless lump in the breast. The moment you feel a lump, especially at an older age group, let's say 30 and 40, you must see a doctor. It may be only a cyst, it may be only a fibroadenoma, it may be nothing, but I think you should consult a doctor. As we said, early diagnosis saves life. Early diagnosis and early diagnosis. Don't be scared that the doctor might tell you it's breast cancer. As I said earlier, even if you have one, there is no way that you can prevent it. There are very few ways that we can prevent it. So if God has chosen you to have breast cancer, there are methods to cure you. There are methods to make you good. You can live a normal life. I wish I could have brought a couple of our young breast cancer survivors who speak from the heart. They are celebrating life. They love life. They made NGOs, and the NGOs are called Yes to Life. They are saying we are normal. We have no problem to anybody else who haven't had breast cancer. They are smart, they are young, they are good looking, they are doing their businesses, they are having high jobs in offices, high positions. They're all absolutely normal. So early detection is the key to having a normal, healthy life, even if you're the chosen one to have breast cancer. I must also tell you that treatment has improved for breast cancer and many other cancers. The technology has improved. We now have equipment wherein the radiation, radiation is like they give you heat therapy after breast cancer, cervical cancer, head and neck cancers, many cancers. The technology has improved. Now we can radiate only a small part of that area. Say in the brain, you can only radiate that part of the brain. You don't have to radiate the whole brain. Also for the breast, you can radiate that small part. The radiation can go exactly to the tumor area and not to the normal surrounding areas. So the technology of radiation has improved. Technology in the form of medications has improved. Now there are all kinds of chemotherapeutic drugs which improves life. These drugs are available right here in India. We have something called targeted therapies where the drugs only go and kill the cancer cells and do not harm the normal cells. Some of these targeted treatments are expensive, but they can cure. So these are available right here in India. The surgery for all these cancers, the breast, the cervical, the head and neck, has improved tremendously. If we talk about the breast, if you are detected in stage 1 or stage 2, less than 3 centimeter tumor, your breast can be saved. You don't have to remove the breast. Your chemotherapy can be saved. You don't have to have chemotherapy if it's an early detection. Also, even if we have to remove somebody's breast for one or the other reasons, the breast can be reconstructed. You can have a normal looking breast. The nipple can be made, the areola can be made. So the treatment has become very patient friendly. Supposing somebody has really come in an aggressive tumor and it's a large tumor, we can do major surgeries. I'm sure you know, for liver transplants, they operate for almost 16 hours to 24 hours. So the anesthesia has improved. The blood transfusions have improved. The blood products have improved. Intensive care wards are there. So the intensive care has improved. And even the antibiotics have improved. So today, you don't have to shy back and say that if doctor tells me I have breast cancer, that means death to life. It's not so. So please, on this International Women's Day, do what I told you, the 3 things: breast self-examination once a month after the age of 20, clinical breast examination by the doctor once a year after the age of 30, mammography at least baseline and age 40, and once a year after the age of 50. Let's talk about a little bit about cervical cancer. Cervical cancer is the second commonest cancer in females in the metros and the commonest cancer in females in the villages. And that's because of multiparity, trauma to the cervix, various vaginal infections, and all that. Cervical cancer can also be diagnosed in very early stages by a test called pap smear. The WHO predicted that if all the women of India could have one pap smear in their lifetime, 50% of the deaths from cervical cancer can be saved. And today you must have heard, now there is a vaccine. There is a vaccine to prevent cervical cancer. And it's being advocated, and I think it's very useful to give it to women before actually they have their first sexual relationship. In fact, it's also recommended for male. And up to the age of 35 to 40, women can have this vaccination. It's a vaccination against HPV virus, which is the commonest cause of getting cervical cancer. So, I wouldn't be talking more about the cervical vaccines. So the third commonest cancer in females is actually the gallbladder and the GI tract and ovarian cancer and uterine cancer. I think talking about early signs of uterine cancer, again, is any bleeding postmenopausal. Once you stop bleeding, your menopause is there, and if you start to bleed again, there has to be some reason. So in that way, bleeding from any orifice in your body is a cause for concern. Bleeding from mouth, bleeding with your cough, bleeding from your urine, bleeding from your stool at a little older age group is cause for concern. So I think you should go to the doctor for doing a checkup. So this is what I actually want to say in general about your health regarding cancer, because that's one word which women take synonymous with death. But if you take a little care, it is not so. And one can have a normal, healthy life even after you get a cancer or you're prone for cancer. So women today, I once again congratulate everybody for this happy day, joyful day, and to have go out and have family get together and enjoy your life and dream and stay healthy. I have a question here which says, can physical activity reduce the risk of breast cancer? Yes, lots of recent studies. In fact, over the last 5 years, we have come to realize that fat produces some substances which cause inflammation, and chronic inflammation can cause cancer. Also, you must know that one of the causes for breast cancer is an overactivity of estrogen. The estrogen is a hormone that comes from the ovaries. As I said earlier on, if your period starts before the age of 12 and finish after the age of 54, which means that you have a long period where your estrogen from your ovaries are working on your breast. And that is one of the reasons why breast cancer happens. Now, as you're getting better nourished, your period starts early and your period stop later. So that is why the cancer is rising in India also. So fat produces estrogen. So even when you stop having your periods, obese people's fat produce estrogen from androgens. So that estrogen possibly is the cause for increase in breast cancer. So if you do physical activity, you have less of fat and more of muscles, and that is why we think physical activity can reduce the risk of breast cancer. I have another question which says, can a healthy diet help to prevent breast cancer? Yes, it can. In fact, eating more of vegetables and fruits, and all the vegetables and fruits of all the colors, red, green, blue, and yellow, they are healthy for you in many other ways, but also in reducing breast cancer. I must also tell you a story of a Brahmkumari, an American Brahmkumari, who came to give us counseling session at the Apollo Hospital. We run a breast support group where our survivors come in and they are given counseling and diet, what diet to take. And a lady came and she said she was diagnosed by pathology specimen at the Mass General Hospital in America, in Boston, with cervical cancer. She said she told them she will not take their treatment. And she said, I went on a diet and I went on meditation. The diet, she reduced from 100 kilos to almost about 35-40 kilos. She said, I was wearing size 14 or size 0 dresses, and she went on meditation where she said she was harmed by her parents and she had to forgive them. And every time she sat for meditation, she initially said, forgive them, forgive them. But then she was told, no, that's not the way. So slowly and slowly, she forgave from the heart. She gave it from the mind, and she was so calm. She said, it's 50 years and my cancer is cured without any doctor's treatment. Now, I can believe it. But I think we all should not do that till the time we get into that state. So do your medical treatment, what our system says. In addition, yoga, meditation, and diet does play a big role in reducing the mortality and also in reducing the incidence of cancer. Can drinking alcohol increase the risk of breast cancer? Yes, studies have shown that if you drink more than 2 drinks, more than 2 packs of wine or even whiskey or any other drink, your chances of breast cancer are higher. And I think it is like inversely, because when you drink, you eat junk food and you tend to put on weight and you don't exercise. So I think it's related in an inverse fashion. Does a family history of breast cancer put someone at a higher risk? Definitely. Please make a note of it. You must have heard of so-called BRCA1 and BRCA2 that our famous just our famous actress that came from America said that she had Angelina Jolie, who said that she was found to have BRCA1 and BRCA2, and she decided to get both her breasts out. So BRCA1 and BRCA2 is a gene defect, is a defect in the gene that is passed on from your parents to the children, mostly from women to the offspring, the daughters, but it also can be passed on from the father. So out of 100 breast cancer patients, 5 to 10% of the breast cancer are germline mutation, are passed on from the women to this. And if you have a BRCA1 and BRCA2 positivity, then there is almost an 80% chance that you will get a breast cancer. Now, 80% chance is a very high chance. So in that case, you have to do various measures, which I don't want to go into detail. You can actually check it up with anyone of a good physician. So a family history, anybody who has 2 members of a family, of immediate family, as I said, mother, sister, mother, sister's daughter, more than 2 members of a family with breast or ovarian cancer, you actually should go in for BRCA1 and BRCA2 testing. It's only a blood sample. 5 ml of blood is taken, that is tested, and within 4 weeks one gets the report. And if there is a positivity, then you have to take more strict action. But one family history also puts you 2 times than the normal female, right? Somebody who doesn't have a family history. But it does not mean that if you don't have a family history, you will not get breast cancer. So the inverse is not true. What kind of impact does stress have on breast cancer? I think stress, stress in any form is bad for anything. There is no studies to suggest that stress causes breast cancer more or less, but I think stress in general is not good. What I believe is that you have a problem. You sit down and find out the solution. At that point, whatever solution you thought was good and you acted on that, if you can act on that, then forget about the results, because the results are not in your hand. You sat, you thought, you gave your mind, you discussed, and you acted on it. So why stress it? And whenever somebody makes you angry, just forgive that person. I think forgiveness is a great thing, not to have stress. If somebody hasn't said right to you, or somebody has been unkind to you, just forgive that person and do what you are. Don't, your life should not depend on others. Is there a link between HRT and breast cancer? Yes, definitely. I think some of the gynecologists may not agree, but studies have now definitely shown that hormone replacement therapy for longer than 2 years increases your risk of breast cancer. If you have symptoms after menopause, you can take hormones, but for a short period of 6 months to 1 year. That also under supervision, because if you have a strong family history or strong risk factors, you should avoid it. There are other means to get rid of the postmenopausal symptoms, but just to take it because you want to feel young, you want to look young, and that is not advisable. What screening options are available for breast cancer? I think I said that earlier. Screening means when you have no symptoms at all. So the screening methods, as I repeated earlier on, was breast self-examination once a month after the age of 20, especially after your periods. Stand in front of the mirror and look at yourself. If you find any change in the shape, size of the breast or nipple or areola or underarms, make a note of it. Then you should lie down and examine your right breast with your left hand and left breast with your right hand, and use the tips of these, they use the pulp of these three fingers, not the tips. This, and just rotate around your breast and palpate it and see if there is any lump or thickening or anything. I think this has to be taught by a doctor or shown to you in an educational DVD. We do have DVDs at the Apollo Hospital, which actually shows you very beautifully how to do it. There are survivors who have undressed themselves and have shown on their bodies how to do a breast self examination, because we strongly feel if for some reason you can't go for your mammography after the age of 40 or 50, you can't go to the doctor, at least do a breast self examination. How long until considered cancer free? It's a good question, because most cancers we say 5 years after cancer treatment, if the cancer doesn't come back, you're cured. But in breast, it's 10 years, because there are some recurrences that happen even after 7 and 8 years, especially the hormone receptor positive. So 10 years if you're cancer free. But if there is also a little caveat to this, if you're ER or PR, the hormone negative ones, if for 3 years you haven't had a cancer, there are chances that you will not get it. So now when we get young breast cancer patients, we give them 3 years if they're hormone receptor negative, and if they haven't had a family and they want to start their family, we give them go ahead to go and have children. And we have had a couple of patients who have had their children. We can actually, the new advances is that we can actually save their ova, which takes only about 12 days to get their ovas retrieved, freeze it, and they can be, ovas can be kept till the time they are ready to start their pregnancy. So ova preservation has also become much in demand, especially when young women are getting breast cancers. Are modern food habits a cause of worry? How does it contribute to the risk of breast cancer? Yes, modern food is a cause of worry. I'm afraid it is. We all go to work, come back home at 6:37. If the food is not ready or you're not willing to take it, what do? You have a cup of tea and you have snacks. You have fried snacks, you have dry snacks. You fill up your stomach with that. You have drinks and you eat snacks with that. In the morning, you have no time for your breakfast. So you run with either a sandwich or a toast in your mouth or nothing at all. So we don't eat a healthy breakfast. We don't eat a healthy dinner because we eat on snacks, and there's no time for lunch. Or you grab a sandwich at lunch, or you grab a hamburger. Again, so the food habits are bad. I think when you come back home, at least if you exercise your mind and say you're going to have dinner right away, or within the next 1 hour or half an hour, have your dinner, and that will save you a lot of worry about your health. How does menstrual and reproductive history affect breast cancer risk? I think I've already said in my initial this ones that when you have periods, um, then your estrogen levels and the progesterone levels go down. When you have your children, you know that you don't have periods, right? So when you have your children, your estrogen and progesterone levels, the estrogen levels are down. And also when you breastfeed, the ovaries are not working. So ovaries are not working for almost 18 months, 9 months of pregnancy and 9 months of breastfeeding. So 18 months when your ovaries are not really functioning to the normal, the estrogen levels are not affecting your breast. You know, we had 8 children. So all that my mother did was from the age of 16 to the age of 35, she had 8 children. Every 2 years, she had a child. So for 18 months, she had no periods. So the ovarian hormone was not very active. So she had her ovarian hormones in her 25 years of reproductive history, no ovarian hormones, so no breast cancer. So even now in the villages, the incidence of breast cancer is very low. In fact, half of what is in the metros, 1 in 52. Now, the problem is that we can't go back to what our parents were. We can't afford to have 8 children and 6 children and 4 children. We are actually going to have 1 or 2. So, we can't change our reproductive history. We can't change our uh, the pregnancies and other things. So, what we have to do is to take care of the other preventive methods that we have available for breast cancer. What kind of impact does stress have on breast cancer? As I said, I don't really think there are studies to say that stress increases breast cancer, but stress, as we said, in other ways is not good. Now, I have some more questions coming in, and that says, at what age one should be more concerned most about breast cancer and how often the screening should be done? Age is a big risk factor. I forgot to mention it. Increasing age increases the risk of breast cancer. After the age of 60 or 70, 1 in 8 women, even in India, have breast cancer. But at the age of 30 and 40, the risk is 1 in 300. So as you age, the risk of breast cancer goes up. I think this is the aging process. So age is a big risk factor. We do not advise mammography before the age of 40 because when your ovaries are active, your breasts so-called are dense, have a lot of glandular tissue, a lot of milk producing gland, so the breasts are dense. When the breasts are dense, mammography does not help because it misses cancers. So mammography actually, the American Cancer Society or United States Task Forces advises it once a year after the age of 50, but most cancer organization would say once in 2 years after the age of 40 and once a year after the age of 40. In fact, mammography is the only screening modality that has reduced breast cancer mortality in the West. The breast cancer mortality in the West has come down for the first time because of the awareness, because of the screening methods available, and the good treatment that has come around. In India, we have still to go a long way in creating awareness. We still see patients, educated, high class, rich people coming in stage 3 of breast cancer, and we just wonder why are we sitting in these big ivory towers and just treating them and not creating an awareness? So our NGO called Forum for Breast Cancer Protection main aim is to spread breast cancer awareness. We do that by making lots of educational DVDs, and if you want one, we could of course send it over to you. Any side effects with the screening test? Another good question. There are concerns that screening causes radiation, and radiation is a cause for cancer. Screening, yes, of course, it's an X-rays of the breast, and an X-ray is a radiation, right? But our background radiation, the radiation that we get from our atmosphere, is 4 times than the radiation that one mammogram gives. So once a year mammogram is equal to 4 times the mammogram what our background radiation gives. So the side effects of mammography are very negligible, if any, and the benefits are much more. So you should not be concerned if an unaware person says mammography causes radiation and radiation can give rise to cancer. That's not so. Will any hair fall out when I have cancer? Will it grow back? Yes, I'm afraid if a cancer or breast cancer is diagnosed, or any cancer is diagnosed in an early stage one breast cancer, 50-60% of the time, you don't require chemotherapy. It's the chemotherapy. These are drugs that kill the cancer cells. Now, most chemotherapies do not differentiate between the normal cancer cell, between the cancer cell and the normal cell in the body, the normal dividing cell in the body. And the dividing cells in the body at our age is the bone marrow, is the hair, is the nail, and um, and the mucosa, the mucosa, the lining of the mouth, and all that. So these chemotherapeutic agents do not differentiate between normal dividing cells and the cancerous dividing cells. They kill everything. So that is why the hair fall out when you have to have chemotherapy. So as I said earlier, the diagnosis, you may not require chemo. But if it is late or the tumor biology is not good, you would require chemotherapy. The hairs will fall off, but they grow back. Once the chemotherapy stops, the hair they come back as beautiful, as thick, and the same color as before. We have actually cancer survivors who have started to make beautiful caps for people to wear during the chemotherapy when the hair fall out. Can benign non-cancerous cysts become cancerous? If there is a lump in the breast and a doctor has investigated and has told you that this is a cyst, the cyst can be diagnosed only on ultrasound or on MRI. So if it is a cyst and if it's sure it's a cyst, it will not become cancerous. So if you have small cysts in your breast, both breasts, small or big, you don't have to worry. They might stain your breast. There's no medicine to reduce them or disappear them. They let them stain your breast. They will not cause any side effects on your body, or they will not become cancerous. So cysts in the breast are benign and not to be worried about. What causes ovarian cancer? Again, most of the cancers, we do not know why they occur. There possibly are defects in the genes. There has to be a defect in the gene for the cell to become abnormal. You know, normal cells divide till the time they are required. When they are not required, they stop growing. If you have a wound on your skin, the skin will grow back, and once the skin is completely covered, then it stops growing. But the cancer cells will not stop growing, they'll continue to grow. So we don't know why they happen, but ovarian cancer also 5% of them have this germline mutation called BRCA1, in fact BRCA2 and BRCA1. So if you have a strong family history of breast or ovarian cancer, you can get tested for BRCA1 and BRCA2, but have a genetic counselor to counsel you that if you're positive, what you can do or what you can't do, and whether there is a need for you to have genetic counseling or not. So ovarian cancer, 95% of the time, we don't know why it happens. I'm afraid there are no screening methods. But if you are on a strong family history, maybe you should go for a gynae examination, and you should go for a gynae examination and a pelvic ultrasound and maybe a CA1 to 5 if you are on a higher risk. But normal women, this has not, these three methods have not shown any reduction in mortality due to ovarian cancer. What are the margins in relation to breast cancer? I think this is a question. This must be a question from somebody who had breast cancer, or whose relations or mother or sisters had breast cancer, and is asking about margins. You know, when there is a small lump or the cancer is diagnosed in stage 1 or 2, and as I said, you don't have to have your breast removed, so-called mastectomy. You can only have the lump removed, but the lump should be removed in such a way that where you cut, the cancer cells should not be present where you cut. Because if you cut through the tumor and some cancer cells are still left in the remaining breast, obviously they'll grow back. So when a breast saving surgery or a breast conservative surgery is done, the margins must be free of cancer. And that is why the surgeons who do breast saving surgery make sure that they go at least 1 centimeter from the palpable margin of the tumor, so that if there are any cancer cells surrounding it, you will not be cutting through this. And the margins are actually examined, the whole surface of the cut margin is examined very carefully by the pathologist to tell you if there are still cancer cells at the margin. And if there are cancer cells at the margin, I'm afraid a reoperation needs to be done. So in India, nobody wants to have a second surgery, so we tend to go even more than 1 centimeter than what is advisable in the West. So that is what is called margins in relation to breast cancer. So if there are no more questions, thank you so much for listening to me. I hope it was understandable, and I hope you got something out of it. And once again, I'm happy to be here with all of you, and I wish you a very, very happy International Women's Day. Thank you and goodbye.